if you're having a response that says we must stop the further transmission of HIV and bring an end to AIDS, it cannot be done in a vacuum that is free, that is totally sterilized of the people who you're trying to reach. And so our role at CRN Plus is to remind our policymakers, as well as our actors and various agencies of change, that there's a role for persons living with HIV in your response, that the most powerful advocates you can get in any response to HIV are the empowered persons living with HIV, and that persons living with HIV are not inept. We can plan, we can organize, and we can set strategy and vision moving forward.
When HIV came in my life, I was a young girl, young woman for 33 years. I have my 2 children, 14 and 12 years. That moment, indeed, discrimination was there. I was living in the Netherlands. I also was a nurse. I can remember when patient came also in the hospital. We as nurse was also afraid to help them, to wash them. But when HIV came in my life, it's bring another philosophy for me. I'm start look for information. Law information was there, but the information there was for me was to change my life. I starting to be healthy, eat healthy, looking about information, and I starting to eat healthy and thinking positive. Today, lot of people I'm support in my country. I give them lecture. I go places where nobody want to go.
When we speak of vulnerability from a CRN Plus perspective, we are speaking of persons who are oftentimes facing the greatest burden, not only of HIV, but of intergenerational poverty, of violence, of neglect. And we need to speak up for those persons. Who are those persons? Young people, adolescents who are often stigmatized and therefore put even more at risk for sexually transmitted infections. We're speaking for persons who may be on drugs, who need to have programs to bring persons and protect these persons. We're talking about people with disabilities, okay? We're also talking about men. The statistics show that the majority of persons who access early health, who are adherent on treatment, and usually are women. We need to also speak to our men to realize that that men are also empowered, that men can also seek medical advice, and there's no shame in knowing what's going on.
I want to talk with the persons living with HIV here in Grenada. We want to meet with you. We want to hug you. We want to tell you are still alive, but we give you the finger, but you have to take and do what you can do. Don't stop yourself anymore in a closet. Come, tell your family, and so you also gonna stop that stigma and discrimination starting now. If you want to meet the 1990 goals, then we have to start, especially the youth, the young ones. I want to talk with them. Go take your diploma, go to school. If you want to have sex, protect yourself because that is the best. It's not 100%, but you can deal with that. But my message is wait so long you can, so that you can make a better decision, you see? Because discrimination is gonna be, but it's us to bring a change.